Well, sometimes I go out by myself and I look across the water, and I think of all the things of what you're doing. In my head I paint a picture, 'cause since I've come on home, well, my body's been a mess, and I miss your ginger hair and the way you like to dress. Won't you come on over? Stop making a fool out of me. So why don't you come on over, Valerie? Did you have to go to jail? Put your house on up for sale? Did you get a good lawyer? Hope you didn't catch a tan. Hope you found the right man who would fix it for you. Are you shopping anywhere? Change the color of your hair. Are you dizzy? Did you have to pay that fine? Be dodging all the time? Are you still dizzy? 'Cause since I've come on home, well, my body's been a mess, and I miss your ginger hair and the way you like to dress. Won't you come on over? Stop making a fool out of me. Why don't you come on over, Valerie? Valerie. 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 Stefan. Why don't you come on over, Valerie? Valerie. Why don't you come on over, Valerie? Why don't you come on over, Valerie? Like a fool, I went and stayed too long. Now I'm wondering if your love's still strong. Ooh, baby, here I am, signed, sealed, delivered, I'm yours, yeah. Then the time I went and said goodbye, and now I'm back and not ashamed to cry. Ooh, baby, here I am, signed, sealed, delivered, I'm yours. Here I am, baby, signed, sealed, delivered, I'm yours. Yeah, yeah. Here I am, baby, signed, sealed, delivered, I'm yours, yeah. I've done a lot of foolish things that I really didn't mean. Now didn't I, didn't I, didn't I? Yeah. Seen a lot of things in this old world, and when I touched them, they meant nothing to me. Said, ooh, baby, here I am, signed, sealed, delivered, I'm yours, yeah. Ooh, baby, baby, you set my soul on fire, and I want you to know you're my sweet desire. Ooh, baby, here I am, signed, sealed, delivered, I'm yours. Here I am, baby, signed, sealed, delivered, I'm yours. Come on, baby. Here I am, baby, signed, sealed, delivered, I'm yours. I've done a lot of foolish things that I really didn't mean. Now didn't I? Yeah. Oh, yeah, 'cause here I am, baby, signed, sealed, delivered, I'm yours. Come on, now here I am, baby. I mean, signed, sealed, delivered, I'm yours, I'm yours, I'm yours. 'Cause here I am, baby, signed, sealed, delivered, I'm yours, yeah. Here I am, baby, signed, sealed, delivered, I'm yours, yeah. I've done a lot of foolish things that I really didn't mean. Now didn't I, didn't I? Ooh, yeah. Ooh, signed, sealed, delivered, I'm yours. Need you closer. and mountains between us, always something to get over. If I had my way, surely you would be closer. I need you closer. You can windsurf into my life. Take me up on a copper ride. You can make it in a big balloon, but you better make it soon. You can reach me by caravan, cross the desert like an Arab man. I don't care how you get here, just get here if you can. Oh, get here. I don't care how you get here, just get here if you can.
Well, good morning, everyone, and a warm welcome to day 2 of the Alzheimer Europe conference. That was Leslie van der A with Stefan Geusbroek, the musicians, and I know that you like them because I have you in my lap here on my iPad, and everybody is cheering the musicians on. They say that they really love the music and it's wonderful to kick the morning off, and they say that it's brilliant that you are able to perform like this that early in the morning. All the comments are rolling in, so that is wonderful. And we have a stormy Utrecht here. Jean, welcome.
Welcome again.
This is like we have a daily breakfast show, right?
Absolutely, and we saw the sunrise over Utrecht together, which is a fantastic way of doing it.
Where do you see the sun? I missed it.
It's pretty grey, but I'm sure that the sun came up.
Yeah, I think it's very stormy. My hair is a bit of in stormy, and yours too. Huh? Yeah, all the hair. And I hear that it's stormy and windy almost everywhere except for Melbourne. Thank you. It's hot there.
But we also have some people from Singapore. I think they should also probably have better weather than we have here.
But it's also windy and chilly in Malta, Charmaine says, and in Munich it's snowy. Well, it's a stormy day, but it's warm here, and we are going to have a lovely day 2 of the program with interesting speakers and lots to do. There's also one thing that I'm looking forward to, especially Jean, and that's you cooking.
That should be interesting. So if you are interested in doing that, you can join us still. So you have to send an email to Gladys, and you can actually join us for the live cooking at lunchtime. So if you want to see me embarrassing myself cooking in front of everybody, you're more than welcome to join.
Yes, you're going to embarrass yourself. That's good. I'll find a way to do that too, then we're good colleagues. So you found your way again to the platform, and make sure that you vote for all the polls that we present to you, because we really love to know what you think of everything. And we have one poll open, the first one already. Is this your first or second day at the Alzheimer Europe conference? So what does the results say?
Well, it seems that we have a lot of people that have already been here before, because 93% of people said that this is their second day, and 7% of the people are here for their first time. But a big welcome to both the new joiners, but also the ones that have already been here before.
Yeah, it's wonderful. And that people come back is wonderful, and that the new ones are there is wonderful as well. For people who weren't here yesterday, you can talk to us on the platform, and you can go to the social Q&A section, and there you see a plus, says ask, and then you can ask your question, but you can also comment. So the compliments for the musicians, they came in there as well. You can tell us about the weather, and there's a trick here, and somebody, some of you just found it. We can't put your name on the beginning, but somebody like Heike said, I'll put my name in the end of the comment, and then we know who you are, which is nice because everybody wants to know who they're joining the conference with. So if you add a comment or a question, it's nice to put your name in the end, so then we know. That would be lovely. Let's see. Let's ask another question and see what the people answer. What word sums up your impression of the conference so far? We've been reading lots on Twitter also, but what are the words that people are entering right now?
Well, the top one which comes up is inspiring and engaging and interesting. So I'm not complaining about the choice that speaker or the audience have about how they would describe our conference so far. Captivating, conference, connected, cozy, which is interesting because cozy really means kind of comfortable, like something you would do in your own home. So if we are able to portray that kind of image and atmosphere, I think that's great.
That's nice, because we all, the whole crew and you and I, we just sleep here on the floor.
Almost, yes.
Yeah, it feels like that. It's a warm atmosphere. So no, but just a little about the importance of today. Because of course we are here playing talk show host, and that's all great, and you are on Twitter. But what do you think is important for today?
Well, again, the topic of the conference is resilience in dementia. I think yesterday we heard from Kevin from Ireland really about how the pandemic impacted his life as a person living with dementia. So today we are having a plenary which is really looking at, well, how has the pandemic impacted people working in the sector, how has it impacted Alzheimer's organizations, and also how has it impacted the research community. So very interesting topics, and we have some great speakers as well.
Yeah, and see what we can learn from there. Kevin made quite an impression yesterday, so did Chris. Of course, the other speakers did as well, but their experience was very important. I read that on Twitter. You were active at Twitter,
of course, also. And also like our participants were also quite active on Twitter, because there's a number of tweets that we can share as well.
Oh, that would be nice.
We have a number of tweets that people were happy to show. And
maybe we can show the Twitter images. That would be lovely. Maybe later. Oh, so they see it, yeah. Okay, good.
I think really the first slide what you see is, first of all, that people were happy that we were finally able to be together. So there's a number of people
so happy
about
as well.
Which was quite nice. But then really the kind of impact that Kevin's speech has, and the fact that this is not a conference where we talk about people with dementia, but it's really a conference where people with dementia are an integral part of the conference, and that was something that really came very strongly back, and people really were very happy to comment about that. And then there was a nice photo as well that was shared with this group of fantastic people that are helping us here today. So we had a photo backstage of all the kind of LOE team that is so supportive and such an important part of making this a good event.
Live online events, LOE. Yes, there are many people here, and we're just the ones.
But then also, like, we had a number of other tweets, so it wasn't just serious stuff. And I think last year we already started with kind of people sharing their kind of dogs and cats with whom they are watching the kind of conference. And again, we have a whole range of people that shared photos of their dogs, their cats. We even have one person that shared a photo of their chicken. So there you go. This is a conference that is not just popular with people watching, but also some of the animals and dogs.
Yes, and we are looking forward to seeing all of your animals, stuffed animals allowed as well, right?
Of course, yes. We even had, absolutely, we had a stuffed animal, a stuffed elephant that is watching as well with us.
Yes, exactly.
And just as a reminder as well that what we want to do is, like, anybody that is joining and tweeting, we will be offering the most influential tweeter of our conference, we will be offering them a free registration for the conference, and also, If it's going to be an online conference, of course, just that. Yeah. But otherwise, it will be also paid travel and accommodation to attend the conference in Bucharest at the end of next year.
Yeah, we have to believe that that will happen.
Absolutely,
right?
yes. Fingers crossed. Huh?
That's a great award. And animals also do have an effect, and can have a positive effect on people with dementia. So the theme's also right.
Absolutely.
Yeah, it's a coincidence, but it worked well. Listen, Jean, of course, your mission always is to put Alzheimer and dementia first or high on the agenda of every European policymaker and every stakeholder in Europe. If we ask you the question first, what is the overall situation now dealing with that, infected or changed by COVID-19, maybe?
I think to some extent, I think that people with dementia were sometimes the forgotten victims of the pandemic, because they were really kind of a group of people that were very significantly impacted. Yeah. A lot of people died in nursing homes. I think every country had really bad statistics, isolated. Sometimes alone, without being able to see their families and so on. So the kind of lockdown had a very significant impact on people in nursing homes, but also people living at home, as you heard from Kevin yesterday as well. So this is really a pandemic that has been a double whammy, in a way, for people living with dementia, because they're coping with their own situation, and on top of that, they had to deal with the pandemic.
Yes, I see. So let me see, when we ask you at home or in the office, compared to before the pandemic, would you say that your overall situation has improved, says 18%? What do you think that would have caused an improved situation?
It's interesting to hear that, because I would have thought that for most people it would have been worsened or at least stayed the same. Mm-hmm. But maybe also some people felt that they had now better connections because they had people living at home with them, that people that before had to go to work, they are at home living with the person with dementia and having better communications at home than they had before, because they don't need to go to work all the time.
Yes, so maybe some technical solutions here and there for contact and people just feeling the urgency to make that possible. It stayed about the same, 49%, and deteriorated, 34%. So that's not that bad.
I'm surprised by that, because if you say 50% of the people say that pretty much it has been unchanged, that sounds more positive than I would have thought. So that's a good...
Yeah, I think that's... But we would love to know more about that. So if you can put that in the Q&A section with the comments. So just to explain us a little how it can have improved or stayed the same. So something was stable there. And then we have another question for you. What aspects has the COVID-19 pandemic affected most?
Yeah, and the options that you had here is the daily lives of people with dementia, nursing and residential care, diagnosis and medical follow-up, counselling support and respite care, then dementia research, and then last but not least also fundraising and funding of Alzheimer's organizations.
Yes, very nice. So if you vote, we can have a look at the results. What do you think? What would your answer be?
I would think that it has, well, if I had to choose only one of those, I would go with the daily lives of people with dementia, because but you know, residential care can be impacted, but even if residential care is impacted, it is the daily lives of the people living in residential care that has been impacted. Mm-hmm. So, and I think that's, after all, we are organizations that want to support them as best as we can.
Of course.
And if their lives are daily impacted, then we need to try and find solutions for them.
Yes, been hard work. Yeah, you're right. Most people say the daily lives of people with dementia, but nursing and residential care as well. Also diagnosis, counselling, dementia research and fundraising. Every area is in fact affected. Okay. Well, yeah, of course. Well, it's logical, but it's sad. So we are talking about resilience and what to do and what to learn with that. And now we have speakers on Zoom again.
Absolutely. So shall we go and meet our three speakers?
Let's meet our speakers. Right. Yeah. Yes. So we're here at the desk. This is more like a news show, isn't it?
Absolutely. So this is where the serious part actually happens, and where we're meeting the speakers, going to enlighten us and really share their kind of experiences of how they have dealt with the pandemic during all of the last 2 years.
Very important. And you can keep your, please let your questions keep coming in. And if you see a question that somebody else asked and you like it, just click the heart or the comment. So then you vote that question up and we will make sure to ask our speakers. So let's go to Jim Pearson. Yes, we go to Scotland, right? I
Absolutely.
suppose. Yeah.
So Jim is,
Morning,
first
Jim.
of all, he's also member of the Alzheimer Europe board and is our honorary secretary, but he also has a day job, and his day job is actually to be director of policy and research for Alzheimer Scotland. And as we talked about resilience, we thought that he would be a fantastic speaker to talk about how this pandemic impacted Alzheimer's organizations and their activities.
Yeah, reinventing everything almost, right? Welcome, Mr. Pearson.
Good morning.
Good morning. In what city or town are you?
So I'm based in Glasgow in Scotland. It is still dark here.
Yeah, I see.
Yes.
Yeah, it's dark here still as well. I don't think it will be light today. But you are our shining light. Okay, please tell us please tell us your story.
Yeah, good morning. Thank you. And thank you, John. And thank you for a fantastic start to the morning. The music was a great way to begin the day. So I'm assuming that everyone can see my slides okay? Oops. So I am Jim Pearson. I'm the Director of Policy and Practice at Alzheimer Scotland. And I want to share a little bit today about our experience of supporting people with dementia and carers and their families throughout the pandemic. We've learned so much, I think, over the past 2 years. This is a pandemic which has given rise to an unprecedented crisis for many of us in recent history. And the measures and the virus and the measures put in place to prevent its spread have impacted on all aspects of society. And as I said, we're learning every day, not only about the nature of the virus itself, but the direct and indirect harms of the measures put in place to fight it have been causing. In Scotland, there's an estimated 90,000 people living with dementia. And each of those people, to a different degree, rely on the daily routines, the social interactions, the community-based groups and activities, as well as health and social care services as a way to maintain their well-being and live as independently as possible in their own communities, or to be well supported in any setting, including hospitals and care homes. And the reality is that during this past 2 years, all of those supports have been disrupted, and as a consequence, been direct and indirect impacts on the lives of those people. And I think this session, kind of talking about the resilience of organisations like Alzheimer Scotland is important, but equally important to remember that while we were impacted, and I'm going to describe some of that, our response was always about how can we continue to support people with dementia and their families and carers. So everything that we did during that time in terms of restructuring and responding to how the pandemic was impacting on us was about how we support that front line. How do we make sure we continue to support people with dementia? So this slide, I suppose, represents, if not an entirely scientific representation of the virus itself, the impact that it had, everything that we do, the practice, the people that we support in communities, all of the face-to-face support that we provided in our 21 dementia resource centres across Scotland, that are post-diagnostic support link workers, community activity organisers, dementia advisors working throughout Scotland, the face-to-face home-based support that they provided, and community-based support, all of that stopped overnight in March of last year, in March 2020. And all of that came to a halt when we went into lockdown. That had an impact on everything that we did, our policy work, our campaigns, all of the work that we do with our stakeholders around fundraising, building corporate relationships, running events in communities, our development and innovation, the people that work in Alzheimer Scotland and our structures, everything was impacted. And finally, of course, that impacted on new developments like the establishment of Brain Health Scotland, We had to pause the launch of that. And ultimately, of course, our income. And at that point in the year, we were predicting a potential £3 million deficit in our budget. That's a substantial deficit. And it meant that we had to think about how did we respond to that. So this has been a difficult time. We have, like many other organisations, had to restructure our services. We were lucky in a way that in the UK there was a financial assistance from the government through a furlough scheme that helped us to maximise some of the income and reduce some of that deficit. But it did mean that we had to unfortunately restructure how we support. So Alzheimer Scotland today is a much leaner, slightly smaller organisation, but one which is really looking forward to a positive future. I mentioned earlier that much of what we did was to provide face-to-face support in people's own homes and in their communities. Almost overnight, everything that we did had been adapted to provide people with support in different ways. During this time, our helpline, our 24-hour dementia helpline, became the most front-facing part of the organisation. And we did see over the course of that almost a third of an increase in a third of calls. But equally, too, we saw an increase in the length of calls by about 27% as well. And that, I think, demonstrated the distress and the stress that many people were experiencing and were seeking much more emotional support from our helpline, people dealing with the isolation and the lack of support that was perhaps available to them because of that disruption that I mentioned earlier. Equally, during, and this is just a snapshot from March of 2020 until March 21, all of the support that we were providing was primarily then being provided digitally. So we provided almost 50,000 therapeutic interventions using digital platforms, over 5,000 groups. We did continue to visit some people at home, where we managed to negotiate with local commissioners where daycare service had been stopped for those people who were considered the most vulnerable and most need of that level of support. We did manage to continue some small-scale face-to-face support to support carers and prevent stress and distress. But everything, as you can see there, became either telephone inquiries, video supports. We had a number of really innovative programs where our colleagues in the front line really stepped up to the mark and created a whole range of online activities and groups for people to join. And as you can see, we had almost 5,000 groups over that time. Our post-diagnostic support, link workers and continued to provide support for people. But again, that became, rather than face-to-face, one-to-one, it became very much based on digital supports online on telephone. And they managed to continue to support just under 6,000 people living with dementia, established 2,700, slightly more, 2,715 digital support groups, digital cafes, and also supported people to be referred on for other professional assistance that they might require. So everything that we did, I was looking, when I was preparing this presentation, I was looking through some of our previous annual reports and looking at the images of people together in our dementia resource centres and outside and community activities, outside and joining in fundraising activities. All of that stopped, and almost overnight we had to very quickly, using the digital technologies that we have to find ways of connecting with people in very different ways. And also our campaign. And so we, through those tens of thousands of contacts we were having with people with dementia and family members and carers, we were hearing day in, day out of the trauma and the difficult experiences that they were having. We published a report during the pandemic called COVID-19, the Hidden Impact Report, where we made we highlighted the experience that people were having through their own stories and through their own experiences, really powerful stories about the challenging nature of their lives living through this pandemic. And we used that to call for significant action. Now, this pandemic clearly has had a significant impact, but I won't be the first person to say this. It didn't create all of the problems that arose during that time. There were significant gaps in our health and social care and other systems that existed prior to the pandemic. And unfortunately, those were exposed for some people in the cruelest of ways. So much of our campaigning through that time was about recovery and building a system of health and social care that could support people with dementia beyond the pandemic. I'll tell you a little bit more about that in a minute. We also were highlighting the nature of the trauma that many people were experiencing, particularly families and people who lived in care homes who had been unable to see each other during lockdown. Variable application of guidance around access to care homes, many people who hadn't seen each other for months. We campaigned for some time for the establishment of action on this, and the Scottish Government did agree and funded Alzheimer Scotland to provide what we call our Action and Rights team. This is a team that we will maintain, but it was initially funded for a 6-month period, and it's been extended. But that was about supporting people living in care homes and their families to start to reintroduce meaningful contact and support the reopening of care homes. And that work is still ongoing. We also received funding to establish a national counselling service to deal with some of the trauma and distress that many people with dementia and families are carrying. It sounds grand, it's a national counselling service. It's actually only a couple of counsellors, but a significant contribution that's certainly helping us to meet the demands of people who have experienced such a difficult time over the past 2 years. Our locality pathway going forward, we have adapted our service. As I said, we restructured the organisation, we realigned everything. We're coming out of this pandemic in a way that we're able to reintroduce our community activities in a small scale, face-to-face way, but we've got a much more blended approach. Those digital assets that we use, those ability to connect into people in a different way has worked really well for many people, and we will continue to do that. And it works particularly well for people in some of the more remote areas of Scotland. So we've learned a lot through the development of some of the digital initiatives that we had that will continue to be part of the mix of our community and local pathway. Just coming to the end of this now, during the pandemic, the Scottish Government sought out an independent review of adult social care within Scotland, and that review was published last year, and it sets out a vision of transformation for a new model of social care, adult social care within Scotland, which has been accepted by the Scottish Government. And they have committed to implementing the recommendations of this in full, and they're going to create a new national care service. We have been really supportive of that. We think that review set out a really positive and transformative vision for adult social care within Scotland going forward. But the truth is that it is 4 or 5 years away, and people who have lived through this pandemic, people with dementia and their carers who are living now don't have time. They don't have 4 or 5 years to wait for the improvements that we hope that national care service will bring. This is a vision that Alzheimer Scotland have had for some time. It's a vision which has underpinned the development and the key commitments of Scotland's 3 national dementia strategies. But the truth is, it's too fragmented. Had all of these been in place prior to the pandemic, supporting people right through from before a diagnosis, promoting an earlier diagnosis, making sure people have high quality person-centred post-diagnosis support, coordinated and integrated care when they needed it, right through to advanced illness and end of life. Had we had that and all of those commitments fully delivered, we would have come through this pandemic better. But the truth is that vision for too many people has been fragmented. So we've been campaigning with the Scottish Government to revisit the commitments that is already made within the national dementia strategies in Scotland, and to look where those areas where delivery has not been achieved. And we've sought to campaign around those areas. We've been communicating and campaigning with the Scottish Government around establishing a dedicated dementia directorate in Scotland, where that shared vision is a key system for transformation and redesign. And that includes continued investment in brain health and prevention, increased and guaranteed access to post-diagnostic support link workers, implementing the commitments around developing a dementia practice coordinator role for integrated and coordinated care, and implement the recommendations that they've committed to within advanced dementia care and specialist teams. So I won't go through all of that, but that's our kind of key 7 areas of campaigning. As I said, as an organisation, we are very different looking than we were before this pandemic. But I think we are in a healthier state now looking forward. The deficit that we were predicting is nowhere near what we were. We're real clear on our campaigning priorities, and hopefully really structured well, that we can continue to support people who are living with dementia and their families and their carers as we go forward. Thank you.
Yes. Thank you. Thank you so much, Mr. Pearson. Jim Pearson, or James.
Jim, actually, yes.
Yeah, but James was in the screen. You see, James Pearson, it's below there. That's what it says.
James is my Sunday name.
Exactly, yes. Thank you so much. I was wondering, these key recommendations, like you presented in the end, is the government, is your country and your institutions listening to those recommendations?
So these are existing commitments. So each of these recommendations relate to commitments that have already been made in Scotland's national dementia strategies, and are based on evidence-based models of practice that Alzheimer Scotland had developed. For example, for post-diagnostic support, we've had a commitment national commitment for post-diagnostic support since 2013 in Scotland. It's made significant progress, but the reality is that in every year since it was introduced in 2013, fewer than 50% of the people who should be offered post-diagnostic support have been offered it. So while we've made a significant impact on better post-diagnostic support, not enough people are accessing it. So I have to say, we've made some progress in that. The Scottish Government have committed to an extra £3.5 million of ring-fenced funding, which is making its way right now to our integrated health and social care partnerships, to build the capacity to ensure that everybody gets access to post-diagnostic support. So they are listening, but we've got a long way to go.
Mm-hmm. Yes, I see. So Jean, what did you think?
I also congratulations from my side, really, on how inventive and innovative an organization you have been, because it's incredible how quickly you have changed and adapted to quite difficult circumstances. You mentioned the kind of support by the Scottish Government in supporting maybe through furlough. What other measures and direct aid did the Scottish Government provide to your organization to adapt?
Well, we did receive some specific funding for particular areas of work. So I mentioned the establishment of the Action and Rights team. That was a team we were planning to establish anyway, Jean. But the focus of that was about supporting people with really complex, difficult inquiries. But the focus of that became really about supporting the reopening of care homes and helping families and people in care homes. So they funded us for a year. For that, to establish that Action Rights team. They also provided funding for the National Counselling Service. And as I said, we just had a significant commitment to fund additional post-diagnostic support link workers. We also get funding to support things like our active voice work, the Scottish Dementia Working Group, National Dementia Carers Action Network, and key areas of development around improving hospital care. So we've had a long-standing relationship where the Scottish Government have funded Alzheimer Scotland to contribute to some of the commitments of the national dementia strategies, and some of that has been stepped up. So we have had good financial support from the Scottish Government.
That's a good thing. Yeah, good financial support. We also asked the question to the viewers.
Absolutely. And the question that we actually asked viewers is whether they thought that the situation in their country or their organization or company or center, whether they had been affected by the pandemic. And you can see that actually 50% of people say that it actually stayed the same,
Good.
which is again quite positive. But you will also say that the people that said that it's actually better than it was before is only 7%.
Yeah.
So which means that 43% of people that are attending this conference had the funding and the financial situation of their organization, company, and organization
Same or
affected
less.
negatively. Yeah?
Yes, it should be the aim to improve, right? So one last question, then we'll talk to you later. But because somebody in the audience wants to know, how do you integrate these recommendations with the program Dementia Friendly Community? Scotland does a great job in DFC, this person says. We don't know the name.
Sorry, is that for me? Yeah.
Yeah, for you. Yes, sorry. How do you integrate these recommendations with the program Dementia Friendly Community? That's the question.
Well, these are all about, so at the heart of all of this, whether it's good quality post-diagnosis support, supporting people, any part of the illness, it is the community that they live in. So, and every element of it. So these are not really detailed recommendations or bullet points, but at the heart of all of this is about citizenship. It's about recognising that people with dementia, and our model and that approach is always about supporting people to live as independently and as well as they can. And at the heart of where they live is their community, whatever that may be, whether that's a care home, whether that's living in a hospital setting, or whether it's living in their own home within a community. The importance of having communities that are able better to understand and respond to the needs of people with dementia is integral to that. So, yeah, I haven't mentioned dementia-friendly communities in there, but every element of those recommendations, every element of the models behind them is about community-based supports and community dementia-friendly communities. And I know many of my colleagues across Scotland who are involved in developing community-based initiatives. I'm well aware of the significant and fantastic contribution that they make. Yeah.
Thanks a lot. So, okay, thank you so much. We will talk to you later, and we have to move on because we have somebody from Ireland.
The next speaker is Pat McLoughlin.
Yes.
He's the CEO of the Alzheimer Society of Ireland.
Yeah.
But again, he's also a board member of Alzheimer Europe. So we really have, in a lot of places, we have the best people from our national organizations that are also represented within Alzheimer Europe. And I think from Jim, you really heard how it impacted Alzheimer's organizations, community care, and their kind of advocacy work. And I think this time from Pat, we're going to hear much more about how residential care and nursing home care was affected in Ireland, and maybe learning what they've done right and what they've done wrong during these years.
Done wrong? Maybe. Good morning, Mr. McLoughlin.
Good morning.
Good morning. So you are, in what town are you?
I'm in the town that I'm living at the moment. It's Kilkenny. It's about 100 kilometres from Dublin, which is where our national office is.
Okay, there's the office. So no, I don't know that. Did you?
I didn't either.
No. so let's please hear what you have to say, and then we'll ask you some questions later. Thank you.
Okay, thank you very much. Well, Ireland, with a population of 5 million, had its first case of COVID confirmed on the 29th of February 2020, and its first recorded death on the 11th of March 2020. Just recently, the Health Protection Surveillance Centre reported that we have had a total of 5,609 deaths. 85.6% of those had underlying conditions, and 19 were healthcare workers. This presentation concentrates on deaths in the early months of the pandemic, and it bases the analysis on two groups that were established by government, one called the Expert Panel on Nursing Homes, and also a special committee on COVID-19 response, which was a committee of parliamentarians. We'll also outline some of the ways in which the Alzheimer Society of Ireland dealt with these issues also. So the next slide, please. Okay, the next slide as well, please. Okay. So the response to the COVID pandemic was public health led, and the primary governance structure established in Ireland was the now well known in Ireland called the National Public Health Emergency Team, called NEFIT. NEFIT recommended the establishment of an expert panel on nursing homes on the 14th of May, quite close to the actual first set of deaths, to examine the issues. And later that month, the panel was appointed by the Minister, and it had the following terms of reference, which you can see there: provide assurance that the national protective health and other measures adopted to safeguard residents in nursing homes in light of COVID are appropriate, comprehensive, and in line with international guidelines and any lessons learned from Ireland's response in nursing homes to date. Also, to provide an overview of the international response to COVID-19 in nursing homes, utilising systematic research process, and to report to the Minister of Health by the end of June in order to provide immediate real-time learnings. So the next slide. So the panel adopted an evidence-informed and consultative approach to completing 5 interrelated areas of work. Those included review and analysis of the available epidemiological data, rapid systematic review of measures to protect older people in long-term residential centres, a 3-part consultation process involving meetings with stakeholders, inviting written submissions from stakeholders, and a public consultation, site visits to 3 nursing homes, and engagement with residents, relatives, and persons identified from independent advocacy organisations who had expressed a desire to share their thoughts and experience. Now, the expert panel did undertake an extensive process of consultation, and a range of survey templates were developed by the support team, approved by the panel, and disseminated through written invitations and a public call for submissions on behalf of the panel. Interestingly, they report that across all meetings, the following key themes were consistently identified: timeliness of the response, the challenges presented by managing a new disease, the implications for any future model of care, interdisciplinary cooperation, the role of general practitioners in providing care and leadership, staffing in nursing homes, the community, and regional response and future protective measures. Also, across all the written submissions, similarly, the following primary themes were identified: nursing home procedures, communications, oversight and guidance, future preparedness, the nursing home model of care, and representatives and advocates. So the next slide. So the panel's key findings and recommendations relate to nursing home procedures, staffing levels and skill mix, communications across the health system, oversight and guidance, future preparedness, the need for a revised model of care for nursing homes, which is something we had advocated for a long time, representation and advocacy, and end-of-life care. It did find that there was increasing evidence to show that highly dependent persons can live safely and more happily in domestic settings, provided their required home care supports are in place. And that was an important finding from our perspective. We had been advocating and still advocate for a proper statutory-based home care scheme. It also found that nursing homes should be part of a continuous spectrum of care of the older person in the wider healthcare system, with provision for multidisciplinary support. It also assessed the need to focus on the development of a new model of care, including needs-based and dependency assessment policy and protocols and governance structures in the nursing home setting across the community. So you can see there the summary, the recommendations, they're centered around the thematic areas that are below. Public health measures, there's a range of them, and they are in the actual part of the presentation that will be available. But they relate to public health measures, infection prevention and control, outbreak management, future admissions to nursing homes, nursing home management, data analysis, community support teams, clinical, the issue of the general practitioner lead role in community support teams and in nursing homes. And next slide, please. And you can see the other range of issues that are dealt with. So a very comprehensive set of recommendations by what was well regarded as a group of experts in the area, a very small group, and they did their work over a very short period of time. So the next slide. This is a busy slide, but it shows the total number of deaths linked to COVID-19 is from the report, and it shows then the number of care home residents in red as a percentage of all COVID-19 deaths. So the next slide as it relates to Ireland. So you can see that by the 22nd of June, there were 1,717 deaths at that stage. Now, when you consider that we've had 5,600 deaths since March of 2020, you can see that quite a considerable number of the deaths did happen in the early period, and the 63% of those were care home residents as a percentage of all COVID-19 deaths. So the government also established a special committee on COVID-19, and that was established by the Parliament to consider and take evidence on the state's response to COVID-19. And it's important to remember that this was a group of parliamentarians with quite a different perspective on issues, and they looked at the total response by government and by society. And the primary focus of the committee was of necessity health-related matters, including the deaths in nursing homes, the adequacy of testing and contact tracing, the impact on healthcare workers, and the impact on non-COVID healthcare provision, which was quite significant. And in addition to meeting a range of experts, which they did, the committee also received detailed evidence from those who were directly impacted by COVID-19 and their representatives. The committee, despite devoting more meeting time to this single issue than any other, was unable to get satisfactory answers, in their view, as to why 985 residents of nursing homes died after they had been infected with COVID-19. The next slide. The key issues that emerged from the evidence by the government committee was that the state, through the public health authorities, became overly focused on preparing acute hospitals for the oncoming pandemic in February and March, and failed to recognise the level of risk posed to those in nursing homes. There were delays in reacting to an evolving and deteriorating situation in nursing homes, especially in the provision of supports like replacement staff and PPE. While Trojan efforts were made by nursing home staff, there are unanswered questions as to why some nursing homes were free from COVID-19, whereas others were severely impacted with the death of residents and the sickness level of staff, and that there had been a failure to provide answers to the relatives of those who died, and that this exacerbated their pain and suffering, that that issue must be addressed. So the next slide. They made a recommendation that a public inquiry should be established to investigate and report on all of the circumstances relating to the individual deaths in nursing homes, and the draft terms of reference should be brought before the Committee on Health as a government committee by the end of 2020. And it identifies some of the issues that should be dealt with: the large-scale discharge of patients from acute hospitals to nursing homes at the beginning of March, and that was really to protect the acute hospital system, and particularly pressure on intensive care beds, which was a feature of the situation in Ireland. Also to look at the decision-making around those discharges in individual hospitals and by the HSE, the Department of Health, NEFIT, who I mentioned earlier, and by the government. The response of those said actors of the difficulties encountered, and the recommendation by NEFIT on the 10th of March that visitor restrictions to nursing homes was premature. And this did cause a lot of difficulty for people, and especially, I would say, carers of persons who were living with dementia, because they didn't often understand what COVID meant or social responses. Also, to examine the decisions taken not to transfer patients with COVID-19 from nursing homes to acute care settings, the medical expertise and treatment available in each nursing home, the nature of the healthcare plans and medical records. And they did point out that the actions taken cannot be examined in the light of what we now know about COVID, its transmission and treatment, but instead must be examined in the light of what was known or ought to have been known at the time when those measures were taken in preparation. So, next slide. We also recommended that a review should be taken into the impact of privatisation in Ireland's nursing homes and to ascertain its impact on nursing levels, expertise and qualifications of staff, medical and other facilities available in older people care settings as a result of the policy decision by previous administrations to incentivise private care settings, resulting in 80% residential care being in the private, and the adequacy of funding to deliver optimal outcomes. The next slide. Also to examine the systemic issues that led to poor outcomes for residents, including the failure to upgrade homes, leading to a situation where sick residents could not be isolated and were sharing bedrooms and bathrooms, and where this was the norm, it contributed to the spread of the virus. The ongoing decision made by the Health Service Executive, which is our national planning and commissioning body and also provides significant services, to place residents in nursing homes that have compliance issues, especially compliance with infection control. Lack of a proper framework relating to the number and skills capacity of healthcare workers, and the delay in reviewing the adequacy of the regulatory framework for nursing homes, which had been an issue highlighted for some time. So the next slide, please. Also, the failure to invest in acute step-down hospital capacity, which led to the state having to transfer so many residents into long-term residential care settings. Lack of a coherent policy on the care of older people, which has seen the continuation of long-term institutional care in large settings where ownership had flipped from the public to the private sector over the previous 30 years. A policy of privatisation into the nursing home sector that was disconnected from the public health system without due debate or consultation, and the failure to prioritise empowering older people to remain at home and develop different types of arrangements. So, next slide, please. So we did make submissions as a society to both committees, and the issues that we covered in our submissions related to the fact that the data on causes of death was not being captured accurately because dementia was not considered the key cause of death. At the time that we were making those representations, there was data from the UK Office of Statistics revealed that dementia to be the main underlying condition for 1 in 4 COVID-19 deaths. And we also, in other countries, had similar evidence. So our issue was we weren't even capturing the data, so the system was not responding to the particular needs of people with dementia. We also pointed out that restrictions in nursing homes were having detrimental emotional and psychological effects on people with dementia. And that research had shown that people with dementia did not understand the public health advice on social distancing and visiting restrictions, causing confusion and distress. The technology was difficult to operate, and that there was a need for better integrated care with better oversight by the regulator, and the particular challenges faced by in Ireland. So the next slide, please. So we carried out research, and that pointed out that restrictions had led to a significant and largely irreversible deterioration in people living with dementia. The statistics are there: 40% reported a decline in their physical health, while 54% reported a decline in mental health. 81% of carers concerned about a decline in persons with dementia. Frontline staff are reporting encountering more people experiencing suicidal thoughts, and 77% of carers feared getting sick and being unable to care for the person with dementia. The next slide. In summary, I believe the evidence suggests that we did get many things wrong, both in terms of planning and having a more integrated system of care for older people, and indeed, as I pointed out earlier, the lack of sufficient acute hospital beds, and particularly intensive care beds, meant that there was pressure on other parts of the system as a result of that. Yes, I think we have carried out early assessment by both reviews, and many lessons have been learned. And the government have decided that there will be some type of an inquiry or evaluation. They would wish that it would be non-adversarial. I think we would all wish that that would be the situation. The society does welcome the strengthening of community-based services, and especially home care hours. And for 2022, at least 11% of those hours are going to dementia care. And I would have to say, during the pandemic, we did receive tremendous support from the Health Service Executive and from the National Dementia Office in Ireland. And it did mean that we survived well as an organisation, as well as the generous contributions of the public. Our important challenge is the ability to recruit the necessary community-based staff for this increased investment. But we do welcome the fact that the statutory home care support scheme, which is currently in preparation, will provide a firm base for enabling people to live at home for as long as possible. Thank you all very much.
Well, thank you so very much. Well, that is the hard question, and you proposed that. We have asked you, how did your country deal with people with dementia in nursing homes during the pandemic? But then you emphasized knowing what they knew then. That's the big difficult thing in your mind now that we know more, right?
And hopefully we have learned the lessons, and now that numbers are increasing again, we're not going to run into the same situation where people are again forgotten in nursing homes and residential care.
Oh no, that was really a disaster, wasn't it? But you'd say that in a year we know more already, and then we think, what did we do? Okay, now let's see what the results are here, Mr. McLoughlin. Let me see. Only 8% says that their country has effectively protected people in nursing homes. I'm curious what countries.
It would be interesting to hear that.
So if you answered my country effectively did so, please let us know in the Q&A. I know that no Dutch people would have answered that.
Because also there's two answers that were possible. One is we effectively protected people in nursing homes, but also we kept them engaged and involved with their families and friends. So it's perfect. The double things. That would be the perfect situation.
It's perfect.
But 56% of people say that, well, we protected people in nursing homes, but at the expense of their interaction with their families, and basically they felt isolated, but were protected from the virus. And 37% felt that nursing homes really weren't protecting people enough, and that
not safe.
We saw a majority of people dying in nursing homes.
Not safe and not cared for, and not in a wow. Yeah, that's really horrible. And there was a question also there, Mr. McLoughlin. What would you say was the situation? Somebody asked in the app for people with the dementia all over Ireland, just not only in the nursing homes, but complete. What do you think?
Yeah, there were separate. Well, the research that we carried out, and there relates to people basically in the community. But the fact that we provide 82% of all daycare services, and they were completely closed from the 17th of March, meant that 1,100 people had no face-to-face services. Now, we did, like Jim said, in Scotland, we developed a lot of virtual services. We developed a daycare at home service where the staff at the day centres went out into people's houses to provide for social needs. So it was extremely difficult for people living with dementia in Ireland. And as the debate raised about reopening the economy and reopening centres, the day centres could not reopen because of public health guidelines, and we are only now beginning to have those centres reopened. We hope 30 of the 47 open by the end of the year, but very, very difficult time for people with dementia and their carers in particular.
Yes, thank you so much. Hard times for everyone. We'll talk to you later, Mr. McLoughlin. Thank you so far. We'll see you back later. Okay, yes, because we have another speaker waiting for us. There she is. Hi, good morning.
Great to see you,
Good morning from Stockholm.
Miia Kivipelto, we're wearing the same color today.
I saw that. Very nice.
we agreed on that. Have you been listening to the former speaker?
Yes, I have been the whole way. Wonderful session. Thank you so much for the invitation. Very inspiring.
What would you have answered to this question? How did your country deal with people in nursing homes?
We have had quite challenging situation in Sweden, as you may know, a lot of persons who have died, and we try to take the lessons learned. As you say, the pandemic is not over, and increasing education and information is so crucial.
Yes, but sometimes, we'll talk about that later, because you hear positive messages from Sweden as well, right?
Absolutely.
Yeah, it's all okay. So
Yes.
Yes. So why is Miia here, Jean?
So Miia Kivipelto, she's a professor of clinical geriatrics at the Karolinska Institute in Stockholm, Sweden. But also she's a world-renowned researcher in the field of prevention, early diagnosis and treatment of dementia and Alzheimer's disease. And she's also the principal investigator of the Finger trial. She's the coordinator of the Worldwide Fingers Network and also of the EU Fingers project. So she's here with a very significant CV, and what she will be talking to us about is how have these kind of multimodal prevention studies and lifestyle changes, how have they been impacted by the COVID-19 pandemic, and how are we dealing on that front? And we're really looking forward, Miia, to your presentation.
Thank you so much. And indeed, I will talk about the multi-domain prevention studies and lifestyle changes during the COVID pandemic. And as I already mentioned, let's see if I can go over. Yes, so the pandemic is not yet over, unfortunately. It's still a challenge. And actually, some countries are now having the highest peak of reported cases since this whole situation started in 2019. This map is from WHO, and as for yesterday, there are more than 260 million confirmed cases of COVID-19, including more than 5 million deaths. And luckily, the vaccination campaigns have been there. Sweden has been among the countries where the vaccination has been going very well. But as we know, the situation is not equal, but there are still many countries who have challenges in getting and or distributing the vaccines. So I think it's getting clear that the pandemic is having a lot of effects on the brain health. And here I would like to highlight that there are both the direct and indirect effects on cognition and brain health. It can be the infection effect on brain and central nervous system, but also the effect on organs and systems. And importantly, the indirect effect, disruption of regular healthcare, as we have heard about, and also the effects of physical distancing measures, the lockdown effect. And what we have been doing, I have been part of the WHO Neurology and COVID-19 Global Forum, trying to harmonize the measures, how we are doing research, but also how we can give clinical recommendations when it comes for all these different aspects. So as said, prevention, risk reduction and interventions has been my main topic in my research. And we have the Finger trial that was the randomized control trial showing that it is possible to prevent or reduce the risk of cognitive impairment among at-risk elderly persons from general population. And in the Finger intervention, we had these 5 fingers in the multi-domain intervention: nutrition, exercise, cognitive training, social activities, and all vascular and metabolic risk factors. Social activities seem to be very important, and that has been the finger that has been most challenging during the pandemic, and that's something I will come back to. How can we adopt the interventions in this new normal? The results from the Finger trial were clear for global cognition, but also for the cognitive subdomains, executive function, processing speed, and memory, as you can see here. And on top of that, there were clear effects beyond cognition for functional decline, better mobility, and better health-related quality of life. Very important outcomes for many older people and patients who have Alzheimer. 60% lower risk of other chronic diseases, especially multimorbidity. And related to that, 20% lower risk of hospitalization and also clear health economic benefits. So we have been able to show that the multi-domain intervention has effect both on individual and societal level. There have been a lot of interest to test, adapt, and optimize the Finger model globally. And we started the Worldwide Fingers Network 2017 to support this. And here the Eurofingers has been really leading the novel type of interventions. And I'm very happy that today we are having more than 40 countries from all continents who are part of this network doing this work. Of course, the COVID pandemic has been a huge challenge for these interventions. It has been postponing starting of the studies in some countries. In some interventions, it came exactly when the intervention started. In others, it came middle of the interventions. And in other studies, it came when it was time to do the follow-up. So it has been affecting the intervention. And what we have been doing is collecting the evidence. How can we handle these methodological challenges in these worldwide fingers trials? And here you can see the main publication where you can find more of these reflections. What have been the main lessons learned and recommendations has been for the study design and data collection. Flexibility of the methods. In the finger studies, we have a lot of face-to-face meetings because of the interventions. As I mentioned, the social component is important. And we have been trying to use more digital tools to facilitate intervention delivery and also adherence, and also monitoring how this pandemic has been affecting lifestyle factors. It's also important to analyze the effect of multi-domain intervention in a consistent way and trying to consider how the pandemic has been affecting that. As I said, we don't know yet if the digital tools is as effective as face-to-face. I personally believe that some type of hybrid model is the best because people still want to meet each other, but finding the best solution, I think, is very important. Here, I also think that worldwide fingers can give a lot because we can have the joint analysis and we can in that way compare the differences in different countries because they have been country-specific effects, how the pandemic has been hitting the country, but also what have been the control measures in different countries. So I will give some more examples about this direct and indirect effect of the pandemic and how we have been monitoring. As said, the finger intervention was 2 years, and we were planning to start the 10-year follow-up last year, but that was not possible because of the pandemic. And instead of that, we developed a COVID survey where we wanted to analyze how the pandemic has been affecting lifestyle, behavior, and all different kinds of medical conditions and healthcare, independent living, mood, and well-being. This is done, and now we are moving on with the 11-year follow-up in the finger study. So on top of this affecting the impact on health and lifestyle, we have been also trying to understand how the pandemic has been affecting the long-term effect of the finger intervention. And as said, are there some resilience and vulnerability factors for negative outcomes? We had this mail questionnaire, which we used June 2020, and it included some items which we could compare with National Institute for Health and Welfare population-based survey. So we could compare the finger population and the general population in Finland. There were a bit more than 800 participants and very nice response rate, around 84%. These were a bit older people. 78 years was the mean age. 32% were living alone and 80% had at least one chronic condition. And here you can see the impact of the COVID-related changes in daily life and different kinds of factors. Less contact with family and friends, as could be expected. More unhealthy snacks, 12%. Actually, this number is lower compared to the general adult population in Finland. That could be partly because they had been receiving this finger lifestyle intervention. Less exercise, 33%. More sleeping problems, 15%. And luckily, more remote contact with family and friends, 41%, meaning that people are able to compensate. They learn to use these digital tools. In general, mood and quality of life were pretty good or average, but what I would like to draw your attention is the self-evaluated change during COVID for memory. 15% reported that the memory was getting worse during the pandemic. And I think that's very important observation. We don't know yet why this is happening. Is it more the general anxiety or the loneliness, or is there some other factors as well? Indeed, there were much more feelings of loneliness that increased to 21%, and that was especially for persons who were older and living alone. Lot of cancellations in dental health care, home aid, and rehabilitation services. And again, if this is a more long-lasting situation, that can have a clear impact on brain health. Because of this, we developed and we expanded this COVID survey globally in collaboration with WHO, and we have been starting to use it as part of the Worldwide Fingers Network to really understand the impact globally. And I'm very happy that now we are having 30 countries who are interested to participate. And we have already data from 18 countries. And here you can see the list of countries joining. As you can see, it's a very nice list from very different kind of settings. And altogether, more than 21,000 participants we have already data. And I think this data can really help us to inform what is the better care of health. It can also help some countries to do pre-screening and, as said, adapt the interventions to this new normal. We do have some results already available from Sweden, around 5,000 participants, a bit younger population compared to Finger. The mean age or median age was 67 years. And here you can see the differences between Sweden and Finland. Quite similar patterns, as you can see, less contact with family and friends, quite similar numbers, bit more unhealthy snacks, as you can see here, 26%, less exercise, more sleeping problems, and more remote contact with family and friends, and importantly, even more experience of loneliness. This could be because the pandemic had been more time, it was not only the first wave. And even for the memory, here it had increased that 25% reported more memory problems or change in the memory during the pandemic. My final 2 slides is about the COVID, what could be the risk of cognitive impairment after the COVID pandemic. So it's the direct effect, and that's something we do not know yet very well. And here we have more long-term studies ongoing, which I think are important. But the take home here is that there are some evidence that there is increased risk of cognitive impairment after the infection. Here we have a report for general cognition measured with MoCA, and that there was a clear change, around 1 point change during 3 months, which is quite significant. And the special areas were attention and executive function. Again, more studies are needed. And I think one of the significant publications was the one from UK, showing that there were increased risk for different neurological disorders after especially severe COVID infection, including dementia, compared to other type of infections. And this was especially for patients who were hospitalized and who had encephalopathy. The follow-up time was 6 months, and we could kind of think if there were already some underlying pathology, but clearly more long-term studies are needed to also understand if the COVID infection can increase the risk of cognitive impairment and dementia, and what are the mechanisms. So my conclusions and take-home points are the following. The pandemic has indeed had a significant effect of many modifiable risk and protective factors for dementia and Alzheimer's disease, and it has impacted our randomized controlled trials on this area. There are many multinational projects ongoing to measure both the short and long-term impact of the pandemic and how the lockdown has been affecting that. And this is very important to plan the future studies. So I would say that this is the key priorities here are that we should focus even more on the brain health and risk reduction. It's time to do it now in the new landscape. And to do this in a good way, adapting the preventing interventions and broad improved global collaboration is really the key. So I really want to thank Alzheimer Europe for wonderful collaboration and partnership, and thank you also for other organizations and our funding organizations, and thank you for this.
Thank you so much, Miia. Thank you for your presentation. She really presents well, doesn't she?
Absolutely.
Wow.
That's a good reason why we invited her, of course.
Yes. But the effects are significant. What you presented, the conclusions, yes, almost scary. We asked all the participants as well to comment on the question, which of these lifestyle risk factors were worsened during the pandemic?
Exacerbated. To say,
No,
yes.
no, but it exacerbated. That's when it gets worse, even worse. All right. So people say poor nutrition and smoking not that much. Drinking, I missed that in the list because I hear that the alcohol consumption
That's
increases.
a good point as well. But basically what they are saying is very much what Miia has pointed out and the kind of surveys that you've asked.
Yeah.
So you've basically answered the question that we also asked our participants. But what they're saying is very similar to what you're saying, is that people will have been less active, will have had a lot fewer social interactions. Depression has become a much bigger issue for a number of people. So basically, are we going to have even more people with dementia in the future as a result? What's your prediction on that front?
Mm-hmm.
Yeah, I think that's exactly why we want to study this, because there is a risk that if this is a more long-lasting situation, because these are the major risk factors for dementia and brain health. So we need, and that's why what I said, we need to focus even more on prevention and try to find the new ways to do the risk reduction work. So I think this should be a priority. I think it would be very important to get data from other countries. Now we have mainly Western countries. How is the landscape in different countries? And that's why I'm so happy that we are also having many low middle income countries involved. So there may be differences how the lifestyle factors and the changes are.
Yes, that would be nice if other countries research that as well. But it's a double disaster, really, and also it's prevention. You've said it. Let's bring the other speakers back now. That would be nice. So if hi, there they are, Jim Pearson and Pat McLoughlin. We were just discussing that while you were presenting. There's one main question that we would love you to answer, right, John?
And it's really like, numbers in all the countries are increasing again. Have we learned all the lessons that we should have learned from the first wave? And are we better prepared now that numbers are potentially increasing again?
Yeah.
Maybe starting with Jim?
I think it's a bit of a mixed response in some ways. We absolutely, I think, know a lot more, not just about the pandemic itself and COVID-19. I think by now we fully understand the need to have a better balance between protecting people from undoubtedly a dangerous virus, but recognising the indirect harms that the restrictions have placed. We know far too much now, I think, to go back to what we did early in the pandemic. We're having those kind of full lockdown. So I'm really hopeful that the public health experts are really kind of focused on that too. Certainly, I think as an organisation and like most other Alzheimer's organisations across Europe and elsewhere, I think we know how better to adapt what we do to continue to support people with dementia. But I'm hopeful but uncertain. I think that we certainly, I think the gaps in our health and social care systems will take a lot more, I think, to fix. So that the resilience of our systems has been exposed, I think, over the pandemic, and I think that will take much more investment than we currently have to. If we went back to where we were a year ago, then
Miia, are you hopeful as well?
Yes, I am. First, I think the pandemic has been a great example how quickly things have been moving on with the vaccinations and the broad collaboration. I think we can take that lesson for Alzheimer field as well. Yeah. The balance, I totally agree. It should be both taking into account the direct and indirect effects. And I would think thirdly, we need to move on and we need to try to keep the communication active, because of course people would like to forget the whole pandemic and go back to the normal, but we can't do it yet. No. So I sustainability plan is very, very important. But I'm optimistic that we can do it better.
Yeah, because you also said we can learn lessons from that we can use during life, not only in the COVID pandemic, right?
Yeah,
about lifestyle, especially. So, and what are your thoughts, Mr. McLoughlin? And one short question before you answer that. People want to know where your recommendations are published.
Yeah, they're on the government website,
right.
And we can put up the links to them.
Yes.
They're quite extensive reports. I think we are learning the lessons, but the type of capacity which is required in the acute hospital system is going to take time to bring in additional intensive care beds. I am noticing a greater degree of action in relation to community-based services and a statutory home care scheme, which is absolutely necessary. And we have also been resourced to provide a dementia advisor service right throughout the country, which is the first time, other than our helpline, that there will be a national service which will be based on need right across the country. And that's the way we need to go. In my opinion. So there's greater protection. I still do not see carers getting the type of support that they need. And for example, in vaccination decisions, they are being left outside of that when healthcare workers are being vaccinated. But carers and the contribution that they make, in my opinion, is not being rewarded adequately, and their needs are not being taken into account.
True, right? That's what we hear everywhere.
I think the conclusion of this is it's a bit of a mixed bag, no? It's both, we should be proud of some of the fantastic achievements that we've been able to make.
Absolutely.
We've responded in record time. Organizations have really been able to transform.
Survived.
In such an incredibly quick time. We've been able to identify new assistive technologies in making sure that people could stay connected.
Yes.
But there's a danger that these numbers are rising again. We absolutely have to remember the lessons we've learned and apply them, and hopefully all the energy that we've spent on COVID, one of these days we might be able to spend all of that energy to really try and find a solution for Alzheimer's disease, a cure for Alzheimer's disease.
Exactly.
And wouldn't that be fantastic? No?
Positive energy. Ah, yes. So thank you. Thank you so much. Wonderful, this opening with you as speakers, because we have a good, complete picture of the situation, results, and lessons learned. Thank you so very, very much. Hope to see you one day live, right?
Absolutely.
Again.
Let's hope next year already.
Yes, yes. So thank you so much. Thank you. And to conclude this morning session, we will listen to some music again. But later on, there'll be, of course, all kinds of sessions that people can attend. Can you recommend one apart from your own live cooking session?
Well, there's of course a live cooking at lunchtime, but again you have the choice between 8 parallel sessions, but also at lunchtime. So after the cooking, you have 2 fantastic symposia, one organized by Roche and the other one organized by the European Working Group of People with Dementia. So you're really spoiled for choice, and we are hoping to all see you again for our next plenary session this afternoon.
Yes, but first, let's hear a song. Leslie and Stefan.